And I'd like to welcome everybody to our third part in our five-part series on the pillars of fitness. My name is Craig Cole, and I'm going to be your presenter for today. And today we're going to be talking about flexibility. And flexibility is a very important part of our overall body's health, as it allows us for our joints to have a certain degree of range of motion, allowing us to perform certain daily activities. Now, the flexibility and range of motion within our joints stems from our connective tissue, our muscles, ligaments, and our tendons. And the ability for them to stretch and elongate out allows us to utilize the strength and power that can be derived from our muscles. So we're going to be talking about flexibility itself, the properties that go behind it, and we're also going to get into some discussion about a fitness program that you can do to help improve the overall body flexibility. When we think about flexibility, we think about something that's able to be stretched or bent. In the case of the human body, it's the ability for our connective tissues, our muscles and our tendons to stretch and then apply motion about a joint through complete pain-free range of motion without applied external assistance. Something that negatively impacts our ability to have pain-free range of motion, though, is tight connective tissue, which usually can limit our ability to move, impacting our daily lives or leading to a potential injury. There are several factors that affect the range of motion in our joints. Aspects such as age, gender, body structure, or muscle properties, and our physical activity. With age, we actually have a structural protein called collagen that is located in our muscles and tendons that, as it reduces out, leads to greater rigidity. Aging can also carry with it past injuries or the degeneration of joints, as well as decreased physical activity. Usually around age 70 in us humans, we typically can lose between 25 to 30% of our flexibility. The amount of collagen and elastin, another structural protein found in the muscles, diminishes, leading to that greater rigidity. Other factors such as cartilage and tendon deterioration, loss of synovial joint fluid, which acts as lubricant in our joints, and increased ligament tension all affect joint range of motion. For our body structures, we're not all built the same way, and that goes for our left and right side of the body. Joint structure, location, and tissue thickness all play a role in range of motion. It's important to note that just because your left shoulder, for example, that joint, doesn't always necessarily mean you'll have the same range of motion on the right shoulder joint. When it comes to our muscle properties, though, we also have it where there's changes in viscoelastic properties that can be altered through muscle warm-up and also regular stretching. So when it comes to our muscle properties, a good warm-up prior to a specific activity increases the pliability of the muscle tissue, allowing it to stretch better during that activity. With physical activity, it's important to note that regular activity can stimulate muscles and joints to have full range of motion. There are two distinctions, though, for flexibility: our daily activity movement and also sport-specific movement. All of our mobile joints can improve in range of motion through regular movements or specific activities or training. Resistance training, for example, can help improve range of motion as long as the movement trains both agonist and antagonistic muscles. So if you think about our thighs for a moment, we have our quadriceps and our hamstrings. If we're working on extending our lower leg forward, we need to have it where we have good range of motion in our hamstrings, because we need to have it where that tissue can stretch as our quadriceps contract and engage. Range of motion training does have a science behind it. Our joint range of motion generally is described in two ways, either static or dynamic. Static flexibility is a joint being able to complete its full range of motion under external forces such as gravity, equipment or a certain structure, or a partner-facilitated stretch. Our dynamic flexibility is when a joint is moved through its range of motion by the surrounding muscles that help generate a stretch along with other external assists from a partner or equipment. Dynamic flexibility is essentially when our body helps stretch itself. Flexibility, or our range of motion training, actually has science that goes behind it. Our muscle has reactive properties that respond to two sensory mechanisms found in the muscle and the tendons. We have our muscle spindles and then Golgi tendon organs. Our muscle spindles consist of 3 to 10 specialized fibers that run in parallel to a muscle. And then our Golgi tendon organs, or GTOs, are located at the muscular tendinous areas, and that's the area where muscle and bone meet. Both these sensory mechanisms belong to the central nervous system and are considered proprioceptors, meaning they give feedback to movement and position. So the sensory mechanisms give feedback, but they give it through two signal different transmissions, the afferent and efferent. An afferent is a stimulus transmitted to the central nervous system from the site of origination. Then the efferent is when the central nervous system sends a signal back to the site of stimulus, triggering a response. Continuing on with the science of range of motion and flexibility, we're going to be talking about the muscle spindles a little further. The muscle spindles actually provide feedback on the rate of change in our muscle length, and that's whether the muscle is in a stretched position or a contracted position. The muscle, though, is going to have two sensory responses in a stretch reflex, but then also something called reciprocal inhibition, which causes our antagonistic muscle to relax against the agonist muscle, which prevents any further stretching or injury. But our muscle spindles have two further responses that occur simultaneously. Ultimately, as the muscle stretches, so do the muscle spindles, causing them to lose their shape. When a certain amount of stretch occurs, the muscle spindles trigger a response for the muscles to contract through a stretch reflex. The stretch reflex then has two additional mechanisms in it, both the afferent and efferent response. In the afferent response, it sends a signal to the brain that the muscle is being stretched. The efferent response is when the brain sends a signal to the stretched muscle to contract. At this time, though, the triggered response goes to the opposing muscle group, i.e. the antagonistic muscle group, causing it to relax so that it doesn't generate additional stretching to the already stretched muscle in something called the reciprocal inhibition. With reciprocal inhibition, it prevents the stretched muscle from being overstretched and causing tissue tearing or rupture over a joint. So if we think about it from an anatomical standpoint, if we have both of our arms lifted out to the side, hands at the height of the shoulder, and somebody comes up from behind and grabs a hold of your arms and pulls backwards suddenly, this sudden stretch is going to be causing the bicep muscle to suddenly contract and prevent itself from being overstretched, which would cause injury to the tissue. While the bicep muscle is under contraction suddenly, the brain sends a signal to the tricep to relax, and this prevents further overstretching of the bicep muscle and causing damage to the connective tissue in our joints. Now, for flexibility purposes, low static force, such as static stretching, is actually known to be safer and far more effective, as this type of stretch does not trigger the stretch reflex to occur. So when we're sitting there going through a static stretch where we're going through a movement and holding, the muscle is not being triggered to all of a sudden contract. We're actually teaching the muscle how to relax, allowing for further range of motion. In continuing with our two different types of sensory mechanisms within the muscles and tendons, we have our Golgi tendon organs, or GTOs. The Golgi tendon organs respond to changes in muscle tension. So when a muscle rapidly contracts, the tendon lengthens, which senses additional force of pull. Then when a muscle stretches, the tendon shortens, but then senses the stretch within the muscle. This actually helps protect the muscle from tension overload. So when a Golgi tendon organ is stimulated, the associated muscle is sent a signal to it essentially stop its contraction and relax from the brain. This occurs whether the muscle is in a sudden contracted or stretched state. The muscle is basically prevented from overcontracting too quickly. So the Golgi tendon organ undergoes both afferent and efferent responses, just like muscle spindles. In the event of a muscle contraction in this circumstance, the Golgi tendon organ sends a signal to the brain, which is an afferent response, that the muscle is under contraction. The efferent response then from the brain signals for the contracted muscle to relax from going over peak contraction, and then allowing the antagonistic muscle to generate tension, which stabilizes the joint, preventing the tearing of connective tissue over it. For a muscle that is being stretched suddenly, the Golgi tendon organ sends an afferent signal to the brain that the muscle is under tension suddenly. The brain sends a signal back that from an afferent response that it needs the muscle spindles to stop functioning, in that instance to prevent changes or damage to the muscle. Otherwise, the muscle itself would contract against the stretch, potentially causing further damage. Again, just like with muscle spindles, low force static stretching actually activates the GTO response and is also known to be safer because it allows the muscle to go into a deeper stretch due to inhibiting the muscle spindles. So we discussed aspects of the connective tissue over our joints, our muscles and our tendons, but now we're going to be talking about our skeletal system for just a moment. Our joint structure and the alignment of our joints is relatively consistent in most of us human beings, barring any type of injury or birth defects. There are different types of joints within our body, and as you can see, I have some outlined. We have our ball and socket, and some examples of this are our shoulder and our hip, and those actually allow for rotational movement. We have our sliding joint, which is a good example of being our thumb. We have fused joints, which actually consist of our skull, and that means that the fused bones are immovable. Then we have our hinge joints, which a good example is our elbow and also our knee if we think about it, which allow for flexion and extension. But the structure of a joint and its mobility can be affected by variations in the joint shape and size. Both the left and right sides of the body are not 100% the same. So sometimes there can be variances within the actual structure of a joint. You can actually have where a bone fragment may be a little bit thicker on your left-hand side versus your right. And sometimes what that can do is actually reduce your range of motion from a natural standpoint. You can also have it where there are some abnormalities from being at birth or due to injury. In the picture on our slide here, you can actually see where we have a normal set of legs essentially in the center of the screen, and that is where the femur and the tibia basically line up and form almost a straight line. Then we also have it where we have our varus and valgus knee abnormalities, and that is when the knee joint actually starts to kind of either cave in or start to bow out. And sometimes this can actually limit the full effective range of motion within our knee joints. Now that we've talked about the different aspects of what help make up a joint, what helps make up a muscle, and how those different organic structures can stretch, now we're going to be actually talking about the different types of stretching. The very first one we're going to be talking about is our static stretch. And generally, this is considered the most common type of stretch available. There are two different ways of doing it, actively or passively. The active stretch is usually done as an individual, which is one of the reasons why it's so common. The individual themselves uses their agonist muscles or another body part to help move an intended body part through a certain range of motion to stretch out a desired muscle. Then with our passive stretch, it's where we're holding our limb in a desired position with the help of either a certain piece of equipment or a partner. For a static stretch, we're usually trying to hold the position for between 10 to 30 seconds and trying to usually hold it for at least 3 to 4 repetitions through. The second type of stretch is the dynamic stretch. This is considered a controlled or slow motion type of stretch. The individual moves through a specific motion, gradually mobilizing a joint. This helps create gentle tension in a muscle to elevate the muscle's core temperature. Usually this is repeated multiple times, increasing the range of motion for each repetition. A dynamic stretch should mimic the type of sport or activity that you plan on doing. Dynamic stretches usually help increase blood flow to our working muscles, and this can actually help increase our core body temperature, leading to improved performance and muscle extensibility. Another type of stretching that we're going to be discussing is something called proprioceptive neuromuscular facilitated stretching, PNF stretching for short. This is a type of stretching technique that is actually applied and started in the physical therapy realm, but then moved its way onto the athletic training fields, working with athletes that are injured or those that need to have better mobility. Traditionally, this is a type of stretch that is held for about 6 to 10 seconds at peak contraction, and it is really used to help improve muscle elasticity through passive and active ranges of motion. There's 3 different techniques within PNF stretching. We have our hold, relax, agonist, contract, relax, and then contract, relax, antagonist, contract. We want to try to make sure that we have these as clearly discussed as possible. So for hold and relax, it's when we take a body part and put it into a passive stretch. Once this happens, an applied force is put into the body part and the individual gently pushes back against the resistance. This enables a peak stretch to last for about 6 to 10 seconds, and then the stretched muscle relaxes before repeating the stretch again. Each subsequent stretch then goes a little further into the stretch prior. This type of stretching signals to the stretch receptors in the muscle to relax a little bit more. So in our example picture with the runner, their hamstring is the intended muscle to be stretched. We put their leg into a passive stretch under their own power. A partner then applies a steady force against the straight leg, pushing it toward the upper body, while the runner gently pushes back. In this circumstance, the leg doesn't move. So think back to our two sensory mechanisms we talked about prior. We're trying to encourage the stretch reflex for the muscle spindles in this situation to be inhibited to allow for a greater stretch. We want them to relax so we can get the muscle belly to stretch further. This mechanism of relaxation is involved with other types of PNF techniques that we're going to be talking about. So for our agonist contract relax technique, it's still a similar setup like the hold relax, with the body part being put into a passive stretch initially. For the stretch technique though, the muscle is being stretched contracts against an applied force. The limb is allowed to move through its range of motion. Again, in our picture of the runner, the hamstring is a target of stretch. The runner lays down and lifts her leg straight up as high as possible until a stretch is felt, and again, this is our passive stretch. The partner then grabs the leg and provides a gentle force pushing the leg toward the upper body. The runner then contracts the hamstring with enough force to push the leg back toward the ground, and movement does occur in this technique. For our last technique here, we're going to be talking about the contract, relax, antagonist, contract, and that sounds like a mouthful. But again, this technique has the same setup as the hold relax technique. The muscle intended to stretch is placed into a passive stretch. A partner then applies a gentle force to create an additional stretch while the individual pushes against the applied force. Instead of allowing the muscle to go into a relaxed state after this, the individual then uses their opposing muscle group to the muscle being stretched to create additional stretch, along with the partner's applied force to create a greater stretch. So again, in our picture of the runner, try to make this technique a little clearer. Their leg is placed in a passive stretch for about 10 seconds, targeting the hamstring. A partner then applies a gentle force, providing more stretch. The runner pushes against this applied stretch for about 6 to 10 seconds. The runner then contracts their antagonistic muscle group, the quadriceps in this circumstance, in addition to the applied force to create a deeper stretch for another 10 seconds. All three of these techniques help relax the stretch reflex in our muscle tissue, allowing for the muscle to have greater stretch and pliability. This is a great technique for many muscle injuries. The last type of stretch we're going to be talking about today is ballistic stretching. And this is where we're taking movement and we're creating a bouncing or rebounding effect. What ends up happening is we're taking a muscle and we're stretching it and relaxing it through repetitive cycles. This forces a muscle to move suddenly through its peak muscle tension, which if a muscle is not properly warmed up can cause injury. This is one of the reasons why ballistic stretching is not recommended by many fitness professionals due to its higher risk of injury. Flexibility training has many benefits. When a muscle is able to be stretched, it can help reduce the rigidity of that muscle tissue, which can lead to better balance, improve our blood circulation, improve oxygen flow to our working muscles, and also improve hormonal responses due to heightened central nervous system responses. It can also help decrease the amount of load that's being placed on a joint and helping improve range of motion. Flexibility training can also help improve movement coordination as our muscles are able to respond to stimuluses quicker and with better control. So how do you know when you actually need to have some flexibility training? Well, usually speaking from a clinical standpoint, if a person has experienced any type of injury or are in a position of being deconditioned, a range of motion about a joint can be determined through an assessment either using an exercise or therapeutic professional, using various protocols such as using a goniometer, which is basically a measuring device, and also a sit and reach test. Oftentimes, the need for a professional assessment is not necessary though. Generally, a good rule of thumb is to make sure that you stretch after a workout or when you experience general muscle soreness. Usually when it comes to stretching, we want to try to make sure we're going total body with our stretches. We want to try to target areas that focus on our neck, our shoulders, our upper and lower back, and our hips and our legs. It's important to note that any gains that you receive in flexibility training can actually be negated in about 4 to 8 weeks once you stop any type of flexibility training. For program design of a flexibility program, the recommendations for the American College of Sports Medicine state to increase the frequency of your sessions per week, increase the intensity of your stretch, and increase the overall time of the stretch. It's important to note that progressively overloading a muscle during a stretch will cause the tissue to relax, increasing the range of motion about a joint. And again, that goes back to our muscle spindles and that stretch reflex. All range of motion training should begin after a thorough warm-up of the body consisting of 5 to 8 minutes of total body movement. You never ever want to try to stretch a muscle when your body is cold and you haven't been doing anything active. Like good all exercise programs, we want to make sure that our flexibility training program has good design to it as well. In this graph here, it shows some recommendations from the American College of Sports Medicine's guidelines for exercise testing and prescription. For the frequency, or how often we stretch during the week, we want to make sure that we're stretching 2 to 3 times a week, with more being most effective. The intensity of a stretch should go to the point of feeling tightness or slight discomfort. We should never feel any pain. For adults younger than age of 65, we want to try to make sure that a static hold stretch is held for 10 to 30 seconds. For older adults older than 65, we want to make sure a static hold stretch is held for 30 to 60 seconds to get the best benefit. Remember, there are different types of flexibility stretches that are out there. We have our static flexibility, both the active and passive, our dynamic stretch, our ballistic stretch, and PNF stretch. Just remember that with ballistic stretching, there's a certain amount of risk that is involved. We want to make sure too that when we are holding a stretch, we want to try to perform a stretch for about a total of 60 seconds for each flexibility exercise. It is also recommended to perform each stretch 2 to 4 times. And flexibility exercise is generally most effective when the muscle is properly warmed up, either using moderate aerobic exercise or going through passive methods such as using moist heat packs or taking hot baths or showers. It's important to note that those with joint hypermobility, a flexibility training program is not generally recommended, and it could cause injury to the joint and connective tissue if the joint becomes overmobilized. For our next few slides here, I'm going to be actually giving some example stretches that can be done from a total body standpoint. Just like we were talking about in our previous slide when it comes to program design for flexibility, our program here is going to consist of all of our stretches being held for about 30 seconds, and we'll repeat each stretch twice. Now, I'm not going to go into specific details about how to perform these stretches, but we are going to be talking about the major muscles that are affected by each stretch. So in our slide here, we have our chin over shoulder, and in this stretch, we're actually affecting the muscles of our upper trapezius and our sternocleidomastoid, and those run along the side of our neck. Our upper trap runs from the base of our neck down throughout our shoulders. Our chin to chest stretch is going to focus on our levitator scapulae and the smaller muscles within the cervical neck. Our ear to shoulder stretch is going to focus on our upper trapezius and supraspinatus muscle, which again also run posterior of the shoulder. In this slide here, we have some more upper body stretches that focus on our shoulders and our arms. For a straight arm across the chest stretch, we're focusing on our posterior deltoid, our teres minor, and upper and middle traps. For our seated tricep stretch, it targets exactly that. We're going to be focusing on stretching our tricep. Same thing for our standing bicep stretch. Our target muscle for this is going to be both long head and short head of our bicep. Our bent over lat stretch is going to be focusing on our latissimus dorsi. Now with this stretch, it's very important to try to make sure you're keeping your heels right below your hips as best as possible. We want to try to make sure that with this stretch, we're keeping a straight line on our back as best as you can. In this slide, we're depicting stretches that focus a little bit more on our lower body. Our seated hamstring stretch has a primary focus of our lower back extensors as well as our hamstring muscle. Our seated quadricep stretch is going to be focusing on our quadriceps as well as focusing a little bit on our hip flexors. Our standing calf stretch is going to be focusing on our gastrocnemius or our calf muscle. And again, all these stretches here are going to be held for about 30 seconds and performed twice. In this slide, we're going to conclude our example stretching routine. Our first stretch is our seated torso flexion stretch. Now this stretch is something that you need to be very cautious of. If you do have high blood pressure or any kind of occlusion of any of your arteries or veins, it is very important that you do not perform this stretch. This can actually cause you to have where you do pass out. So I'm going to give you a word of caution with that. With this stretch though, it does focus on the muscles of our erector spinae, which are muscles that run down our lower back into our hip. Now for our seated torso rotation here, this is a movement, as you can see, where I'm maintaining still upright posture, but I'm rotating my torso in place. I'm keeping my lower body as steady as possible. This stretch focuses on our internal and external obliques. And then our last stretch here, our seated torso extension, focuses on our rectus abdominis, external oblique, and internal oblique. Now again, just like in our previous stretches, we're going to be holding each one of these stretches for approximately 30 seconds, and we're going to try to perform each stretch twice. Again, I would like to thank you all for joining me for our Pillar of Fitness on flexibility training. Just remember that flexibility training is an important component of fitness. The ability of the muscles and joints of the body to work together to complete range of motion that is pain-free is essential for our daily activities. Having a flexibility program that targets your major muscles and joints 2 to 3 times a week is essential for long-term benefits for either our activities of daily living or more specific performance-based activities like running or jogging. Keep in mind that holding a stretch for longer than 60 seconds does not always promote greater range of motion gains during that stretch period. Sometimes it's better to limit a stretch to about 30 to 60 seconds, but then work on progressing with the following stretching sessions. Again, I would like to thank you for joining me today for this Pillar of Flexibility session. I'm going to have my contact information on the next slide, so if you have any questions, feel free to contact me. Thanks again.